CBS6, working for your health. Sponsored by HCA Virginia.
Experiencing hip pain, stiffness, or swelling can be a sign of needing a hip replacement. Unlike years past, younger people are now experiencing more problems with their hip joints. But a less invasive medical procedure is helping many patients get back on their feet again in just a matter of weeks. Tracy Sears has this Working for You health report.
Laura Fisher has always stayed in shape, whether exercising or spending time outdoors with her family.
I enjoy hiking, and our family's pretty active, so.
But arthritis in Laura's hip joint made staying active a challenge.
I had been in pain for a long time, and when I finally did get the results of the x-ray, it was not that much of a surprise.
Laura needed a total hip replacement, but didn't want a long recovery time. As a younger patient, she was a good candidate for an anterior hip replacement, a surgical procedure that is less invasive than traditional hip replacement surgery.
We're seeing a lot more hip arthritis and hip disease in younger people now.
Dr. Matt Dobzyniak, an orthopedic surgeon, says traditionally surgeons performed hip replacement surgery by making an incision behind or on the side of the hip. Now it's become more common for doctors to use an anterior approach, an incision in the front of the patient's hip.
No nerves are cut, no muscles are cut, no muscles are detached from the bone, which is different than doing a hip through either a lateral or a posterior approach. And because you don't cut any muscle or remove any muscle from the bone that causes the joint to move, patients recover faster.
Laura was the first of Dobzyniak's patients to have the procedure done as an outpatient.
I checked in at 11 and I was home by 5:30.
After a few weeks of in-home physical therapy, Laura was back to exercising.
I was working out in the gym lightly after 3 to 4 weeks, and then probably back to my normal about after 6 weeks or so.
Doctors say most patients are fully recovered after just 3 months and living a pain-free life once again. Working for your health, I'm Tracy Sears.
And to hear more on the latest advancements in anterior hip replacement, join Dr. Dobzyniak on Wednesday, August 21st at Parham Doctors Hospital from 5:30 to 6:30 p.m. You'll find more information on our website at WTVR.com.